it's my pleasure today to be with Dr. Gary Gordon. I'm sure many of our viewers don't need an introduction, but Dr. Gordon is the father of chelation and a leading light in the field of preventative and anti-aging medicine. Now, I think today we're going to be talking about energy medicine, and in particular pulsed electronic magnetic field therapy, or something that is more commonly referred to as PEMF. So it's a real great pleasure that I'm here in front of you and I have the opportunity to hear what you have to say about the subject. Thank you.
I'm really glad to share with the world the amazing, astounding story of an approach that has been known for over 50 years as a medical approach, initially to heal a broken bone when no surgeon could heal it. And over the years, the 50 years, we've begun to find that it would also act as a muscle stimulator. It would treat people with incontinence. Later we found that it would treat depression. Recently we discovered that this approach actually helps treat brain tumors. So we have a medical device that, as the longer we study it, the more we find out that it has applications that we never initially envisioned, because in the beginning we'd never heard of stem cells and we didn't know how this healing was going on. And now we're finding that it has applications in every part of health, including improving exercise for anyone.
Well, this is really fascinating. And I just wonder if you could explain a little bit more about how it all operates and on these specific areas.
Well, the pulsed electromagnetic field device, of which there are many since it's been around for over 50 years. The bottom line is that it is always something very simple. You're going to get some power from the electric in your home, and you can convert that into magnetic energy. Normally our magnetic energy comes from the center of the Earth. But we happen to live on Earth right now at a time that Earth changes, leading to pole shift, North Pole trying to become South Pole. So the normal battery that is fully charged in our battery, every cell is a battery, but the charge comes from the center of the Earth. And it right now has lost 95% of its power. So no one is fully charged today. And so the applications for pulsed electromagnetic field become as diverse as all aspects of health. But if we look at the big picture, it is as simple as laying down on a table and we could put a mat or a coil underneath your body and be putting this magnetic energy into your body. Or I can treat just somebody's knee that they don't want to have operated. I don't let my patients have their knee replaced.
So how do these actions actually work inside the body?
It's taken a few years to learn, because initially all we knew is that this broken bone nobody had healed, and if you put this magnet over the area every day for 3 or 4 months, after 3 or 4 years of not healing, it came together. But we didn't know what a stem cell was back then. We couldn't measure growth factors. So what we know is this: the cells of our body operate as a battery, and you can measure the transmembrane potential of cells and find that when they get too low, the membrane potential will lead to cancer. And when it's high, you can win races. So the trick is to find out how you can get this battery charger for everybody, because we all know when our cell phone is on the last 2 minutes of thing that we're looking for the charger. Well, all of us need the charger, and when you get the charger, not only do you increase membrane potential, which means the battery is now giving the cell the chance to put out of the cell things that it doesn't need in the cell, like too much calcium, and get into the cell things like magnesium, which mean the cell now has the energy to convert our oxygen and our food into energy, which we have a big name for, adenosine triphosphate, ATP for short. But that's the power of a cell. And we know that we increase that power when we use this over any part of your body. So if you have a tumor in your breast, you should first have somebody help you get access to a coil that we can put over your breast, and it will recharge that breast cancer so that it will take up the vitamin C that we put in your vein or in your mouth. And vitamin C, actually proven at NIH, helps kill all cancer. But if the cell doesn't get the charge, It just gives you a healthier toe, but you wanted your tumor to go away. So there's an application here, whether we call it the fitness application of improved exercise or the medical application, it is as basic as life itself.
And what can this mean for the patient?
Amazingly, it can increase your circulation and decrease your pain. It gives energy to your cells. It improves bone density, so you don't have to worry about shrinking and having your spine break down with fractures and broken bones. And it gives you more flexibility. It increases range of motion, how strong you are, increases endurance. And at the same time, it gets rid of spasm, gets rid of edema, gets rid of inflammation. So it's so basic that I don't know how anyone in the future is going to practice any kind of fitness or health or medicine without making this more available to the public, because we know that you can't go in space and travel to Mars or go to the moon without having a PEMF on the ship. So if we know that we need it when you're in space, and since our Earth is losing most of its power, let's just take from what we've learned from space travel and give it to everybody.
Sounds sensible, yes. And presumably from this, it's very good for sports people and for and in that area. It's going to be a lot of benefit for pain and joints. And
it's so critical because any top athlete, when they have something go wrong, can get out of the game because they've got to have that elbow come back, that knee come back. So it's very important in terms of letting an athlete fulfill his potential, because a minor injury knocks him out. But more importantly, it is clear now from all the work I've been doing that every athlete can beat his own record if he first gets fully charged with the use of a PEMF. All athletes will be amazed. They will beat their own best records because none of the cells in our body are having the luxury of a full charge. And the Energizer Buddy showed that he needed to be fully charged to keep going, and we need to be fully charged.
And are there any specific areas where PEMF is of benefit?
Well, since we've had 50 years to begin to appreciate this wonderful tool that we now have studies going on in the field of heart disease, arthritis, osteoporosis, depression, cancer. There isn't any condition that hasn't been looked at now. Anyone can go to Google and put in PEMF, and they're going to get at least 3,000 studies to look at. So when people call me and say, will this help with my child who can't learn or is really stubborn or whatever you call me about, there's probably a study that's been done about it, because when you have something that is changing people's lives as dramatically as this, we have people scheduled for heart transplant who absolutely wind up regenerating their own heart. And we have people with Parkinson's who are totally disabled. With one treatment, almost 80% of the shaking will go away. We have people who've been in a wheelchair for years with total body paralysis called Guillain-Barré, that after less than 2 months of having their own daily application to this machine, they walk on their own power. And we have autism cases that routinely start getting eye contact, and with a few more sessions wind up actually being able to verbalize and function, because this is a key step in our whole body for cells to have the energy to do their job. Now, cells have a very important job. They have to do house cleaning. Yeah. And it's amazing, if you look at the effort a cell has, 40% of its energy goes just to maintain that charge. And now you're making it easy because you're letting the charge be fully recovered so that the patient is now operating at a high level. And when you have the access to this device, every part of the healing operation is improved. So the big thing is that you will also start having the energy for the poison and the toxins that's in everybody in our body.
So, Dr. Gordon, these many applications sound very much as if it's detoxification. And of course, you're known as Dr. Detox.
And it's so amazing that we live on a polluted planet. And when the patient is sick, the last thing 99% of doctors do is even think about measuring the toxins that any large university laboratory can measure. We have polybrominated diphenyl ether, dioxin, PCBs, bisphenol A, lead, mercury, cadmium. Whatever you look for, you will find. And we know that all of these have adverse effects on our health. And they are in the cells. In addition to that, the cells have normal maintenance that they have to do, because inside of the cells, the working parts wind up finally being worn out. And like you keep your car running because you get a new transmission when you need it, or new spark plug, the cells have to throw out the non-functioning parts and push the toxins out. And the PEMF, therefore, has the energy to let those toxins go out. So that's where the nutritional support part of the program has to be, because if your cell is pushing out a lot of lead and mercury and dioxin and PCB, you better have zeolite and high-dose vitamin C and fiber to catch those toxins so they don't just recirculate and go from the left eye to the right eye.
Well, this is really fascinating. So what you're saying is that PMF therapy can help treat many conditions. And obviously a question that will come to mind is, how long does each treatment have to be?
The amazing thing is we see results in as little as 3 minutes. On an autistic child, you put the applicator over the head, and a child that has no eye contact for months gives you direct eye contact. But it turns out that that's the short end. But when you have somebody that really knows that the heart is not functioning and they want to give you a heart transplant, you may wind up with those people actually acquiring their own device, because they may need an hour or two a day for 3 months. So the longest time is 3 to 4 months of an hour a day, and the shortest time is some people with 3 minutes say, my elbow's working again, the pain's gone, that's all I need, doc, I'll see you. But the average is more likely to spend about 10 minutes about twice a week until they start having the full recovery they need. And usually within 10 or 12 treatments they say, doc, my back pain's gone, I don't need a new knee anymore, I don't need the hip replaced.
I know, Dr. Gordon, that you favour a specific machine called the PMT-100. Would you mind telling us a bit more about it, please?
The reason I like the PMT-100 is it was developed by a NASA scientist. It's rock solid, so that if my friends are in Brazil or they're in Bangkok, they don't have to worry about maintenance, and it has power to achieve therapeutic results in a short time. There are other devices that would take 4 months to do what you can do in 1 day when you have adequate power. And the power of this device can go up to as much as 19,000 Gauss. Now, to put that in some understandable thing, Gauss is the measurement of the energy of the magnet that the Earth core generates. So the center of our Earth is molten iron. And that's where the magnetic energy comes from. And at the time of dinosaurs, it was around 30. Today, you're lucky if you get 0.5. So that's clearly more than a 95% reduction. So none of the people on the Earth today are operating as well as they could if they had regular access to a PMT-100.
Okay. And you mentioned the power of the PMT-100, but how does this sort of help the patient overall?
Well, the power of it means that just like if your car doesn't start and you go out in the morning and it doesn't turn over,
yes.
If you bought a trickle charger, the kind that takes a week to try to keep the battery, then it's going to take a week for that car to get enough energy to start. Most of us don't have a week, so we like the real starters that put the energy in now. So that's why the PMT-100 is so unique in that it's rock solid. It doesn't overheat, it doesn't hurt itself, but it produces that tremendous peak of energy. And it's only on for a few millionths of a second, and then it's off. But each time that it goes on and off, it causes an amazing thing to happen in the membranes of our cell that has got a big word attached to it, electroporation, because along with the magnet comes a gentle electric field, but doesn't bother the patient, but it causes the cell membranes to open just enough for the vitamin C and the magnesium and other good things to go into the cell, which gives the cell the energy then to start cleaning house. We have a big word for that. It's called autophagy. Big word, autophagy, cleaning, self-eating. And it means that the cell now has the energy to look around and say, wow, there's a lot of trash in here, let's clean the place up. And that's when the toxins are being released. And that's why it's interesting that my background in chelation and detoxification fits so perfectly with the fact that the PMT gives people the energy to get the cells to push the toxins out, because as good as my chelation has been, it's not enough to get all the lead out of our bones. We need to activate every cell fully and charge them and keep them charged.
So what you're saying, Dr. Gordon, is that this is an ideal machine for clinics, as it provides treatment in a very relatively short period of time. Is there any pain associated with such treatment?
For getting a patient well, there is no pain. However, we can turn it up high enough to use it as a diagnostic scanning device, because it comes with many different applicators, so that if you just have a painful carpal tunnel or a bad knee, we like to have just that area treated most effectively in the shortest time. So they'll have a coil that you can put your hand in. But if you have a whole body that's broken and you're just not working, we'll have a pad that you can lay on. So we can treat the whole body. What's amazing then is that not only has it this power to treat, but we also have a coil that you can use like a hula hoop, and you can stand in it and bring it up over your body. And as you bring it up, I'll have it set up pretty high, because there will find in your body inflammation, and you may not know that you have that. And it's amazing how precise it is. For example, if I put it over your head and you say, "Ow, my tooth," I send you to the dentist and you didn't even know it, but that tooth was pulling you down. So it has the ability to give you a little pain in an area that's sick, but you don't have to stay in pain. I don't just keep on treating you and saying, "Well, go ahead and tough it out." I turn it way down so that you're completely comfortable. If you're a horse, you kind of go to sleep. If you're a dog, you go back to sleep. So obviously it's pretty comfortable. I treat babies. So the point is that it is totally comfortable for anybody getting a treatment, but it has the power to be turned up enough to find an area that needs more trouble. I've diagnosed a patient with an infection in his testicle. He raised it up there, ow, ow, we found him. He didn't realize that so we have tremendous power to heal without pain, with total comfort. You can fall asleep. And as I have found in my body, when I really push myself very hard, I will take that mat that you can lay on, and I'll wrap that mat around myself, because I've taken doctor friends who are old, because I'm 78, and
Yes.
some of my doctor friends are pretty old, and they've been quite sick. And if I wrap them in that pad, I can bring their heart, their kidney, and their liver back to life. And patients that you think aren't going to live more than a few more weeks come right back in the next day. The swelling is out of the legs, they're ready to go again. It's amazing.
That's great. So when we have these toxic patients, Dr. Gordon, are there anything else that we can offer them to help remove the toxins?
That's where my background, as having been involved with chelation therapy, has led into a perfect marriage of all of my previous work with this exciting application of energy medicine. Because yes, I have moved beyond just using high-dose vitamin C and oral chelation into things like zeolite and all R-lipoic acid and glutathione and humic acid, and how to add things like chlorella and spirulina and broccoli. In other words, the toxins are in every person on the planet. No one has ever passed the test at Mount Sinai School of Medicine, even if you live organically and you've never been near any kind of factory. You can't live on the planet without being toxic. So since this approach is going to cause your cells to have the energy to clean house, somebody has to offer your body the things to help it push them out. Or the toxin from the right eye will go all the way down to the liver, even get presented to the intestine, go down 2 feet and get reabsorbed, and it's back in your left eye. So that's as simple as it can be. So obviously high-dose fiber, high-dose vitamin C, oral chelation, the use of zeolite, glutathione, all R-lipoic acid, the use of all the greens, the chlorella, the spirulina, barley green, broccoli, all of these things are part of the program. There is no one single product that can handle all the toxins, because there have been millions of chemicals released into our environment. And in fact, these chemicals like bisphenol A have been documented to impair the body's ability to even handle toxins. In other words, it disrupts a process that we call methylation. Methylation is one way the body deals with these poisons, by adding a CH3 group to make that poison less toxic. But in order to do that, now I have to give my patients methyl B12 and methylfolic acid. So technically, if I have a patient with multiple sclerosis or cancer, I'm going to be using a lot of nutritional support. But at the top of the pile, we know that when we have a vitamin C that has what we call negative ORP, so that it doesn't upset your stomach, so for the first time you can take 4, 5, 10, 15, 20 grams or more every day of vitamin C, your body will absolutely urinate out the extra C, but it carries the toxins out with it. And the zeolite was given to us by our maker, because our maker knew that we were going to poison this planet. And the zeolite comes only out of volcanic activity, and it has a sponge-like appearance under a microscope. And every one of the little holes are the exact size, we call them cages, that it takes to catch lead and mercury. So in addition to my oral chelation, which has been pretty powerful, I haven't had a patient die of a heart attack in 20 years, and I cancel bypass. So we've got good stuff. But no matter who you are and what you are, the magnet is going to give your body the energy to deal with problems it has not dealt with. When you were born, you were loaded with these toxins. They've proven all this. The toxins actually concentrate in the baby because the mother's body tries to push the toxins out. So you don't have a chance. You need to know there is no one on the planet that wouldn't be living far longer, far healthier, if they had access to what we're talking about: a good, functional pulsed electromagnetic field and the necessary nutritional support to let it do its job.
That's fascinating. So what we're saying about the PMT is that it can help cure pain, joint issues, and it can help to detoxify the body and generally make you a healthier person.
And allowed you reach your maximum intended useful lifespan. At age 78, I'm an anti-aging doctor, and we can prove that it's part of the regeneration. Dr. Badalik at the McGowan Center for Regenerative Medicine, University of Pittsburgh, regrew the guy's leg after it had been blown off in Afghanistan. And that was using some peptides in conjunction with the use of the energy that you need, because just the best supplements don't work optimally unless you learn energy medicine, and we'll get into that in future times. In addition to PEMF, there are things like low-level lasers and hyperbaric oxygen and other things that are all part of what we do today to change the lives of people.
So that's really fascinating, Dr. Gordon, because what you're saying then is that the PMT can help with joint and pain issues. It can help with conditions such as Alzheimer and Parkinson and being able to cope with them, along with helping to detoxify your body and have a cleaner, longer life.
Exactly.
My goodness, Dr. Gordon, with all this, it's quite clear that there's so much to learn that we really must ask you back again and talk again in the future.
I will look forward to that, because I have the greatest respect for international anti-aging systems and the work that you and your company are doing. I consider you the national leaders and international leaders in helping bring an improved understanding of the quality of life and how long we really are all meant to be able to live. And the fact that you've taken the time to bring the energy aspect into the fine work you've already been doing makes me happy to be available anytime, and will be more than anxious to come back and pursue this subject in greater detail.
Thank you very much for those kind words. Thank you.